always, we partner with Mayo Clinic to bring you the latest in heart health. Much of what we're being asked to do right now, as many of you know, is have you had your flu shot yet? Well, did you know that if you have heart disease, it's even more important to get that flu shot? To explain why is Mayo Clinic cardiologist Farouk Muqaddam and his wife, a family medicine doctor, Dr. Martina Muqaddam. Welcome to both of you. Thank you for joining us here today.
Good morning, Terry, and thank you for having us.
Well, you guys always, Mayo Clinic, we love you guys at Mayo Clinic. You always give us really, really good information. So we all know that a flu shot is important, but Dr. Muqaddam, Farouk Muqaddam, I know we've got two of them here. Why is it so important if you have heart disease to get that shot?
Well, thank you, Terry. That's an important question. The CDC and multiple other health bodies strongly recommend that individuals who are vulnerable or at risk for influenza, at high risk for complications therefrom, should get the flu shot. Now, if you have a cardiovascular condition, and it doesn't matter what that cardiovascular condition is, once you get influenza or you get the flu, it is an added stress on your cardiac condition. In fact, I must tell you that there's ample data, evidence or studies which show individuals have more heart attacks and strokes during influenza season.
No kidding.
Indeed, and there's very many reasons for that happening. One is the simple added stress. The other is the increase in heart rate that may come with the fever as a result of the influenza. The other is medications that you perhaps should not be taking with a certain cardiac condition. And of course, finally, and thank goodness, very infrequently, the influenza or flu virus can irritate and attack the heart directly.
Oh my gosh. So you've already scared me and enough people at home. Dr. Martina, when somebody comes into you, being a family medicine practitioner, and they have extreme symptoms of a flu, would that possibly be an indication that they have some sort of underlying heart disease that maybe you didn't even know about or they didn't know about? Is that an indication?
Certainly having, an underlying heart problem can make, the symptoms a lot worse because of the things that, that Farouk said. So with a common cold, for example, the symptoms are pretty mild. With an influenza, underlying conditions can get a lot worse, so that patients can develop bronchitis and pneumonia, and those things can add an added stress to the heart because not enough oxygen going to the not enough oxygen going to the heart, so everything can be made worse.
Would you treat someone with heart disease differently as a family medicine doctor when it comes to the flu?
Well, firstly, the antiviral medications, if they're given in the first 24 to 48 hours, have been shown to be safe in patients with heart disease. But a lot of patients with heart disease are taking medications that would that are
probably counteractive in some instances.
Right, things like blood thinners, for example, so they need to stay away from non-steroidal anti-inflammatory medications like ibuprofen and Motrin and so on. So it's best to talk to your doctor before you take any over-the-counter medications.
Yes, absolutely. And Dr. Farouk, if someone comes in, and obviously, being a cardiologist, you're already seeing them for some sort of heart condition, is there something that they need to do differently in order to better protect themselves should they get the flu? I know that obviously getting a flu shot is the first line of defense.
Indeed.
But then what?
Indeed. So generally you maintain your well-being and body immunity. So the simple lifestyle things that we encourage, eating right, eating lots of fruits and vegetables because they contain natural antioxidants, going to bed on time, getting a good rest. So those are important to maintain your immunity, not just during the flu season, but throughout the year.
Sure, of course, yes.
The rest of your life.
Yes, and prevention. I mean, that's the first line of defense.
Absolutely, and this simple lifestyle will prevent many diseases, including influenza. Now, there may be family members who are struck with the flu, so those individuals, the cardiac patients, I recommend to them that they keep a 3 or 4 feet distance because influenza is spread by droplet. Now that sounds easy. There's an emotional component. The individual with cardiovascular disease wants to interact with the grandchild or a relative that's visiting.
Sure.
And during that time they can contact. So keep a distance. The third thing, if there is an individual in the house, they should wash their hands frequently, use these alcohol-based sanitary gels that you'll find in most offices,
which
businesses.
we were just seeing right there.
And furthermore, if you're sneezing, do so into a Kleenex or a paper tissue, and then discard the tissue in a safe place.
Well, you know what? We could make a whole show out of this because you are so knowledgeable in this, but prevention is so very, very important just to begin with, and that means get your flu shot if you have heart disease. Thank you very much for both of you, to both of you actually, for being here and sharing some really good information. To make an appointment with the Mayo Clinic cardiologist, you can call 480-301-8200. And don't forget, ABC 15 is teaming up with Mayo Clinic for the Rally for Red campaign. Each month, we'll give you easy-to-follow recipes and ideas to help keep you and your loved ones' heart healthy. Go to our Rally for Red reminders. All you do is sign up at abc15.com/rallyforred. And as part of our Rally for Red partnership with Mayo Clinic, we want to help you and your family kick off the holiday season in a healthy way. Because get this, you could win one of 15 heart-healthy gift bags valued at over $500 with gift cards from Seasons 52, Sprouts Markets, and True Foods, plus a Fitbit. Gotta love those Fitbits. Sign up for our newsletter and your chance to win at abc15.com/rallyforred. All right.